So I just took that off and we are starting again. I hope you can hear me and you can join me. So with this, let's start our discussion. The discussion I wanted to do is the following. From today, thank you, and please, class, tell me how the quality is. So again, I'm going to try to redo this once more. The discussion that we are doing, in this discussion, we are going to look at various vitamins that are interesting and important for us for as immune optimizers. I don't want to call them immune boosters, but Chantal, good morning, and tell me how is it going this time? So vitamins that are immune helpers or optimizers. Then we'll talk about the trace elements. For example, we've talked about zinc before. We'll also talk about selenium and copper. Then we'll talk about the nutraceuticals, which are designer foods or herbs or other foods that are of use for the immune system. We'll talk about the probiotics. Probiotics are therapies that are supposed to be for the long-term use, for example, for chronic diseases. So we'll look at those as well. And finally, allopathic medicines, for example, the medicines that we've been talking about, hydroxychloroquine and remdesivir and more. With this, as I've said that before a few minutes ago, that what we'll do is this: we want to figure out that while we are healthy, what are the things we should do? For example, take vitamin C or vitamin D and zinc and quercetin and so on. Then if somebody is asymptomatic, but maybe COVID positive, they've come in contact with them, then how do we handle that? And guys, thank you very much for your feedback for the sound. It looks like that was a Windows computer. And can you imagine that that computer is actually faster than this Mac machine that I have? That was a brand new machine, Windows. And this is the Mac machine that I'm working on right now, is 5 years old. And this thing is just beating the Windows machine hands down. I'm surprised. And then mild and moderate symptoms, and then critical. So I want to be able to make sure that we are aware of what are the things that we need to have at various stages. So that is the basic idea. And just a few minutes ago, we were talking about it, and that was that for the antiviral therapies that we are going to talk about, what we need to know is the following. Number one, there is a set of therapies that help that prevent virus from entering our cells. So these are the entry blockers. We will talk about them. That is one. Then we'll talk about another set of drugs that would reduce the synthesis, RNA synthesis of the virus. That is that when the virus enters our body, our cell, it synthesizes its own RNA. Then it uses that RNA to make proteins that become a virus. And we have done this discussion many times. Absolutely correct. Steve Jobs did do a great job. And look at this 5 years old machine doing much better than brand new Windows machine, which was for gaming. So it was supposed to be fast. I'm going to return that. And then finally, the third type of drugs that we will see are going to be the one that stop the replication of the virus. So when the virus is now developing, it is assembling, then the replication of the virus is stopped by these drugs. So these are the three main categories of the drugs that we will talk about. So with this, let's go to some news that is important for us to know. First set is this. There is a letter that has been out there in New England Journal of Medicine. And today, because I just switched my computers, I may not be able to show you the links and studies. What they have found in that study is, and it is actually in Kaiser Permanente near my place here. What they've done is from to March Why March 4th? March 3rd was the first death in California from COVID-19. So you can imagine that after that, this was the lockdown. So before the lockdown and after the lockdown, what they did was they measured the hospitalization of emergency situations like myocardial infarction or heart attacks. And they found this very interesting, that the ratio of the heart attack or the incidence of the heart attack before the lockdown was 4.1 per 100,000 during this time. And after the lockdown, the incidence dropped to 2.1 per 100,000 during this window of time, March 4th to April 14th, which is very, very interesting. And what they don't know is they did not venture out and say that what is the reason for this. All they observed was that during the lockdown, people had less heart attacks. I had done this discussion yesterday as well with that broken voice and everything. And somebody had put a comment that maybe because hospitals are classifying every patient nowadays as COVID-19, and that is why the heart attacks are reclassified as COVID-19. And I would disagree with that. We are talking about a fresh patient who comes into emergency as a heart attack patient and is hospitalized. And what they are observing is in this study is that the number of patients coming and becoming hospitalized for heart attacks has gone 48% down. So that is a very interesting study for me. What is the reason for this is not known. Is it that people are staying at home and there are less stressful events around them because they're not going out and not working or not interacting? Or is it something in the environment outside? So don't know what that is. But I thought this is very interesting for us to keep in mind. So Lucy says that we have had similar reduction in UK as well. So Lucy, did anyone find out that what was the reason? And Trey, you're very welcome. So Lucy, please tell me if you knew it, that there is something we know the reason. Let's go back to the discussion meanwhile. And that is the second part of the news that I think is important. This is very important. And I would like us to talk with our friends as well and update them. The CDC, and I want to find that link. So give me 1 second. I'm going to find it. CDC. Where is it? Possible role. Okay, so my notes are in Windows computer that I just took off. So because of that, I don't have it here. So I wanted to show you this. It's actually lots of fun to look at it. I'm going to move that link from here, from my other computer to here. So give me 1 second. So here it is, preventing getting sick. So don't mind me. I'm going to bring it here. So CDC preventing getting sick. I think this is the one. Preparing, cleaning, social distancing. What is social distancing? Tips for social distancing. Okay, so I do not know exactly where it is. Preventing healthy habits, common, take 3 action to fight flu, getting sick of coronavirus. So I'll put the link out. And then we can look at it together. The point I was making was, and now I'm going to just take it. Let's just talk here and I'll put the link out. You can read that for yourself. CDC on their site is now saying that the main way for the virus spread is through the droplets, through the droplets. So that, and then they are saying that no easy spread, not easy spread in other ways. So not only this, that they are saying that other ways may not be that are lesser, they are saying not easy spread in other ways. And what are the other ways? Other ways are this one, for which we've been washing our hands all the time, that is touching surfaces. So they are saying that touching surfaces may not be an easy way to transmit the infection, which I would disagree. Somebody has a secretion from their nose and they put that secretion on a surface, that becomes a fomite, and then we touch that and touch our lips or nose, eyes, that would cause the transmission. But CDC says that that is not an easy way of transmission. They are also saying that the transmission from and to your animals is also not easy. So the CDC has changed their stance. Now, the thing that I wanted to show you on their site was that what they're saying is that this is more of a droplet-based transmission from a sick person to a healthy person. I wanted to show, I had another link as well, but I wanted to show you one more thing, and that is, look, aerosol are also very, very important. So not just a droplet. And I think this is another area where CDC is not fully, I don't know if they're confused or they don't care for this. Aerosol are also an important path through which the infection is transmitted. And what does that mean? So look, there are bigger particles that come out of our mouth and nose when we are coughing or sneezing or talking or laughing. And these are called droplets. Usually these droplets, when they enter our body, they usually stay in the upper respiratory tract area. Because they are bigger droplets, they touch easily the surfaces of our respiratory system and very quickly get adsorbed on the surface or get stuck on the surface. On the other hand, there can be smaller particles. Here, these guys, these are smaller particles, almost 5 nanometer. These particles can also have virus in them, and they can stay suspended in the air for a long time, for hours. And these can actually be emitted by a patient when they are talking, just like I'm talking right now. And when these particles enter a person's respiratory system, these particles can actually travel more distance and go to the lower respiratory areas as well and cause infection there. And the study that I was going to show you was, that study said that the infectivity by the aerosol is only very tiny bit lesser than the droplets. So I do not know why CDC decided not to talk about aerosol and said that the main thing is the droplets. Anyways, I want us to be aware that talking with someone, for example, if you're in a clinic and you have someone in the clinic who is COVID-19 positive and they are talking, that would also create aerosol. Even when the patient is gone for another 30 minutes to 2 or 3 hours, that aerosol can still be present in the clinic, and other people who come in may get sick by that. So please keep that in your mind as well. So I was a little surprised by CDC's stance on both of these things, that number one, this doesn't matter. They didn't say it doesn't matter. They said it is not easy to spread that way. And I would not think it that way. And secondly, they said that only droplet are the main way, which I would once again disagree. And I think it is droplet and aerosol both. So with this, let's start our discussion. So this is the news for today. Let's start a discussion about a drug which is really, really important. And it's a new drug. It has been in Japan, being used there since 1985. The drug name is Camostat Mesylate or Mesilate. So how does that drug work? So look, we have been discussing this, that see this, look at this side. This is A. Here we have a pathogen, coronavirus. it is going to connect to ACE2 here. And we have done this discussion many times that it connects with ACE2, and then ACE2 and coronavirus enter the cell. Inside the cell, the RNA from the virus is released, and that RNA is then used up to make more viruses. Correct? So we have done this discussion many times. There is a important change in that, or there is a further depth in this discussion, and that depth is that on our cells, there is a protein attached to the cell membrane called TMPRSS2. So it means what? Type 2 transmembranous. So look at this guy that is standing here. The legs are crossing all the way from the membrane to inside the cell. So it is transmembranous. It passes through the membrane. Protease. Protease means something that can cut a protein. So see here, you can see this thing cutting the protein. And then serine surface enzyme. So because it is a surface enzyme, that is fine. That is one S. Serine. Most of our proteases or most of our enzymes that break other proteins are called proteases. Most of them are serine-based proteases. Serine is an amino acid. So serine-based protease means what? So these proteases or the enzyme that break proteins, if I make them, if this was the mouth of the enzyme, it has, so let's say this was the monster, this is the enzyme. This enzyme breaks other proteins like the meat that we eat or our own proteins or the pathogens. They have normally a triangular structure of serines, S-E-R-I-N-E, serine peptide or serine amino acid. Serine amino acid helps them bind and break proteins. So these are called proteases. Proteases are protein breaking enzymes. So we have a protein breaking enzyme called TMPRSS2, transmembranous protease, that is serine based and is present on the surface and is type 2. So that is the name of it, TMPRSS2. This enzyme is necessary to cut down the spike protein of the virus. So we know about the spike proteins for a long time. What we are talking about is that the spike protein needs priming. The word we use is priming. What does that mean? Without activating the spike protein cannot allow the virus to enter our body. So how do we prime it? How do we activate it? This protein here, TMPRSS2, what it does is it cuts the spike protein. So let's see how does it cut. So just see it here first. It has already cut the protein, and now that spike of the virus is divided into two parts. One part is connected into the membrane of our host cell, and the other part is bound to ACE2. And the TMPRSS2 is standing here saying, hey, you're very welcome. I primed you. I made you good enough to enter the cell. Good drawings. Thank you very much, Alexander. So now let's see how does this happen. So here is the S protein. This guy here is the S protein. S protein of the coronaviruses, and that is SARS-CoV-2 or SARS-CoV or even MERS. S proteins are made up of multiple domains. They have multiple parts in them. The two important parts that are important for us are S1 and S2 domains. So you can imagine that these are two separate things that are hugging each other, and they are making up the S proteins. Thank you, Carol. I spent some time making them today. Although I'm very, very happy that I was able to open them on Mac from Windows. Otherwise, that would be trouble. So now once the spike protein is present and the protease, so let's say TMPRSS2, once that works on them and kind of cuts them, separates them with each other. So let's make a knife here. So this guy uses a knife, which is a protease, and separates these two guys. So when that happens, when the spike protein is split into two pieces, one of the piece, the S2 piece, develops this spring-like structure. And it has many proteins in it, and I don't think these are very interesting for us. All what is interesting is that one part of the spike becomes a spring-like structure, and the other part of the spike becomes a holder with S2. So see, S1 unit of the spike protein is now connected with ACE2, while the springy part is connected into our membrane. So you can imagine what is happening is, and here is the silly TMPRSS2 being happy for what he did. He thinks that he did a great job, but no. So now what is happening is, imagine this, that spike protein is split into two parts. It has become two hands now instead of one hand, and the virus with one hand, the S2 unit of the spike protein, holds onto our cell membrane, and with the S1 unit of the spike protein, it binds with the ACE2. Now, when the ACE2 allows the virus to enter the cell, the second hand of the virus, the S2 unit, which is holding onto the membrane, allows the virus itself to stay, the membrane of the virus to merge with our membrane. So if you see it, what would happen is, if this was our membrane, the virus membrane will get merged here, and the content of the virus, the RNA, would go in, and the ACE2 will go in as well. But this part of the virus, the S2 subunit, would stay anchored here, and that is how it would keep the membrane of the virus merged here. So the whole virus does not go into the cell. The membrane becomes part of our cell membrane, and the RNA goes in. And for that, it is important for this TMPRSS2 thing, this stupid thing, to cut this S protein into two pieces. Now, having that idea, if we have a drug, see, why is this guy looking so messy? Because his name is messy. So he is Camostat Mesylate. I should have made a clock as well to show he's late. So he has a camouflage. So he's a camostat, and he's very messy as well. So he's mesylate. Right? So now Camostat Mesylate, what the function of the Camostat Mesylate is, it blocks this TMPRSS2. See this guy, TMPRSS2? It blocks the TMPRSS2. And now imagine when the coronavirus comes in, it binds to ACE2, and now it is waiting for this stupid protein of ours, TMPRSS2, and I'm calling it stupid, I'm calling it names. It is useful for our own functions. But in this case, this poor protein is deceived by coronavirus into helping it. So now the coronavirus here, why is he crying? He's crying because he's waiting on this protein to come and cut the spike into two pieces, so that one piece can anchor this membrane and the other piece can anchor with the ACE2, and the virus can go in. That whole thing is not going to happen. Why? Because TMPRSS2 is blocked by the camostat. And because it is blocked by the camostat, the virus is not going to be able to enter our cells. That is very important. So if I now go back up for a second, remember that we discussed that everything we'll discuss now in the drugs is that either there is a problem with the entry, drug will stop the viral entry, or it would stop the viral RNA synthesis, or it would stop the viral replication. Any of those. So this drug, Camostat Mesylate, is in this class. It is a viral entry blocker. And how does it do that? It blocks the TMPRSS2, which then in turn reduces the priming of the the spike protein of the coronavirus, which then in turn does not allow the coronavirus to enter our cells. Is this clear? Is this clear? So here, because Camostat Mesylate has blocked the TMPRSS2. Now, this drug, is it useful? Is it safe? Can we take it? This drug has been used in Japan since 1985 for patients with acute pancreatitis. This drug has also been used in Japan since 1995 for post-operative reflux esophagitis. And then I wanted to make sure that we also see the dose of this drug. I don't have that link open anymore, but I'm down here. The dose of the drug is 600 milligram in 3 divided doses, 3 divided, if I know the spellings of divided, doses on daily basis for acute pancreatitis. That means 200 milligram in the morning, then 200 milligram in the lunch with the lunch, and 200 milligram at night. So this is my actual handwriting. Now you're seeing how I write a prescription. And then 300 milligram for 3 divided doses daily for esophagitis. And over there, once again, it is 3 divided doses. That means 100 milligram in the morning, 100 milligram with the lunch, and then 100 milligram at night. So that is the dose. So there was a study, I would put the link out there. In that study, what they had done was they had calculated that what will be the dose that will be necessary for COVID-19 patients. And they had calculated that 2.4 milligram per kilogram for 1 day divided into 3 doses. So why do we keep saying that this should be divided into 3 doses? The reason for that is that the half-life of this drug is completely eliminated within 4 to 5 hours. So if you take all of the 600 milligram at once, it will be eliminated from the body within 4 or 5 hours. So that is not useful. So what you do is you divide it into 3 doses so that you have a continuity of the drug throughout the day. And due to that, you give it into 3 divided doses. So they have calculated, for example, if somebody, I'm just going to take an easy route. If somebody is 100 kg, then that would mean that 240 milligram should be correct. Is my math correct? So 240 milligram for them. But 300 to 600 is already being used with safety. And once again, the links I would share with you. What is the RX name? So this is the Camostat Mesylate. Yes. So somebody said that they loved the coronavirus that was dead. I'll show you that once more. So let me just wind up about this drug. The links that I would share, please go and check the dosage of that. There is one more thing, just like hydroxychloroquine. There is one more good news about this drug. That is, it is available for 0.1. So 10 cent to 40 cent is the price. It is really low priced. So Lucy, I do not know that if it is available here. This is a drug that has been in Japan, and most of the literature is also in Japanese language. However, I can just very quickly show you that there are many trials now, Camostat Mesylate trials. And I also wanted to share this, that there has been a study in vitro. In vitro study means that study done in a dish. So what they did was they took our epithelial cells from our epithelium. So let's make some cute cells over here. So let's say there are some happy cells from our epithelium. They are having a good time here. They put them in a dish, and then they put the Camostat Mesylate, so that camouflage guy, right? They put that in here, and the result was that the coronavirus entry into these cells in vitro, coronavirus entry into the cells was blocked by this drug. So there is already a study that shows that it works in vitro. And so now there are studies. So look at this. there are trials going on. This is a trial in Denmark. This is the University of Aarhus. I hope I'm pronouncing it correctly. Aarhus, University of Aarhus in Denmark. It is one of their best universities for medicine and I believe for veterinary sciences as well. It is one of the best top 100 universities of the world. So they have a trial going on for Camostat Mesylate on COVID-19 infections. Their trial starting on April 4, finishing in May 1, 2021. It's a long time. But anyways, they are doing a trial. Then there is Camostat Mesylate trials. If I show you more, I believe there is one more trial here. Look at this. So there is another university which is looking at Camostat Mesylate plus hydroxychloroquine. And then there are so many, which is a good news. Just like hydroxychloroquine, I think this one is a great as well. So Camostat Mesylate therapy for COVID-19. There is another trial. So there are some more trials going on as well. Yale is doing a trial as well. So the point is that there are some trials that are happening for this drug. And I am very, 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 very optimistic about this drug after the study they've done in vitro, that this drug blocked the virus from entering the cell. And because this drug has been used in our body, it is not a new thing that, okay, in vitro it has worked, but what would happen if it goes in our body? Is it poisonous? Is it dangerous? Is it less efficacious? Is it more, does it have lots of side effects? So this drug has a pretty safe track record, and it's been used for a long time. So that is the discussion today. I'm just very quickly going to show you the antiviral here. So this is the coronavirus being chopped down by various things or being blocked. So this is the discussion. I am so sorry that yesterday's day was wasted because of the Windows machine, and today's day early was wasted because of that machine. I'm happy that I could put this together again. Sorry I could not show you the links. We will talk about them tomorrow. So with this, I'm going to continue our discussion and go through various vitamins, minerals, probiotics, nutraceuticals, and other drugs as we are doing here to talk about the COVID-19. And finally, somebody had said that they wanted to meet Rola. So this is Rola. Rola helps me prepare the lectures. So Rola, please say hi. So, hello everyone, this is Rola. How are you guys doing? I work with Dr. Drbeen and I am a cool bean. So this is Rola. All right. So I hope that this is all good. My apologies once again. I would remove those bad ones. I would return the Windows machine. We'll live with the Mac and we'll go from there. Tyler says she loves that she has a, that is the only thing I could mimic. Yeah. So Rola is nice. Rola helps me prepare the lectures. Thank you. So we will start again the same time. I am very, very sorry that I wasted your time yesterday because of my new machine. And let's study tomorrow. Bye-bye. Please like, subscribe, share. Please share. And we'll go from there. Thank you very much, Lucy, for liking the lecture. Thank you for joining. And we'll go from there. Bye-bye.